Good afternoon. My name is Hector Ventura. I'm a physician, a cardiologist, a heart failure specialist from the New Orleans, Louisiana, the Oxford Medical Institutions. I was asked to discuss for a little while how can we educate physicians or cardiologists or physicians in general how to give the right medicines to patients that have heart failure with reduced ejection fraction. It's a very important question, although the answers are not that simple. Now, as everybody knows in the field of heart failure is a very prevalent disease and very, with high morbidity and high mortality. And in the last few years, we have new medicines that came back around to take care of patients with, with severe heart failure, especially with reduced ejection fraction. Now, one way to educate physicians, and perhaps the best way to educate physicians, is to report the guidelines. The American Heart Association, the American College of Cardiology have written guidelines regarding the treatment of heart failure with reduced ejection fraction. And perhaps, especially in the last version of the guidelines, it has been, they have been done in a way that people can understand it faster, can understand it better, and they have very friendly to the clinicians to use these medicines. So if we go to educate physicians or people in healthcare, that probably is the best way to have the guidelines given to the doctors, given to the physicians and the healthcare providers, and then from then on to the patients. Now, however, it's also important that in the clinics, when we see these patients, also we can understand how these medicines work. I do believe that if we continue using these type of medicines and reading the guidelines, that will be the best way to educate physicians and therefore to make the patients to receive the individualized therapy and receive the medicines that are correct. So I think that's the answer to the question, specifically with the guidelines, because that's the best way to give the physician the tools in order to give the medicines to the patients.